baby girl off at school. Her school is approximately 5 minutes from the house, and then from her school to my job, it's about 30 to 45 minutes based on Atlanta traffic. So I arrive to work at 9 o'clock, and I check any messages that I may have from the previous day, and I look at my schedule to see who I will be seeing today. First call is at 9 o'clock, and I am reaching out to a male that I have been treating for a few months now for bipolar depression, and we are just going over our last month's call regarding his medications, how he feels his mood is being managed, and how his anxiety is being managed as well. We are also discussing his housing situation, his financial situation. He has some legal issues that he is involved in right now. So we discuss all of those things. And then once I finish that, I write my note regarding updates from our visit. And then we fill out our super bill based on the type of visit, which was a follow-up visit, and his diagnosis, which is bipolar depression. And then we have to send his refills over so he can get his meds. This is the book I use to write notes, like things that I want to remember. So, let's see here. Prefer antidepressant in pregnancy is fluoxetine. Latuda is good for bipolar disorder in women of childbearing age, etc., etc. So, like, key points that I want to remember, I use this book to make notes in if I listen to a podcast, and I'll put the notes in my phone in my car, and then I'll transfer them over to this notebook as like a quick tool. These are some notes that I made when I was in school about medication-induced disorders, hypertensive crisis, neuroleptic malignant syndrome. So these are all of the things that you look out for. Can't really see them, but yeah. DTs, TCA toxicity, hypertensive crisis, personality disorders, blah, 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 and treatments. Today, my caseload is light, and I'm surprised because my schedule is typically full. And when I mean full, so I work from 9 to 5, and we do 20-minute follow-ups or medication management calls. And if I have a new patient, which is not every day, the interview is typically, the psychiatric evaluation is blocked out for an hour. So typically what happens is, say I have 2 new patients, so they'll have an hour blocked off, and then I'll have my follow-up patients, my medication management patients, and those are slotted for 20-minute visits. So pretty much my schedule is always full. Today is Wednesday, January 18th, and like I was saying, the brown slots are my follow-up medication management calls, which are slotted for 20 minutes. The light blue spots are the new psychiatric evaluations, which are slotted for 1 hour. The dark blue spots are, the dark blue spots under the light blue is kind of like an error. But anyway, the dark blue spot in the middle, that's my lunch break. And the white spots in between are just blank spaces where no one is scheduled. So this is very different from what I typically have on a day-to-day basis. Like, typically my schedule is really booked, and I'm going to show you what a full schedule looks like. Alright, so this was last Wednesday, and this is typically what my full schedule looks like. So you see all the brown spots or slots are my 20-minute follow-ups, and so all of those patients that were slotted for that time, they were available for their appointment. Again, the light blue was a new psychiatric evaluation that I did. The 2 white spots were actually filled with brown as well, but those 2 patients either did not answer, had to reschedule, so that's why they're white, but they were brown when I came in on them in the morning. Okay, so typically when I first start my morning, I like to set up my diffuser to get the vibes. You know, I have 3 different oils, essential oils, and I kind of just go off of how my morning started, what I'm feeling like, what I want to smell. So I got the diffuser from Target, got the oils from Target, eucalyptus for revitalizing, peppermint for invigorating, and lavender for calm. And we're gonna go for calm. We're gonna go with the lavender. So what the instructions say? Add 2 to 3 drops, right? But you know, black people, we extra. So I just shake it until I feel it in my spirit that I don't need any more. And then that's it. Put the top back on. And I usually run this for most of the day. I'll put it on the intermittent setting. And then you can change the color. Let's go blue. Let's go green. I like the green. I'm gonna go green. Just set it over here. Most of my follow-ups are monthly. Mostly just, you know, checking in, seeing how things are going since last month, what their mood is, if their mood has been stabilized on their medication regimen, how they're sleeping, how they're eating, how they're tolerating the medications, if I made a medication change at the last visit, if they're tolerating it, if they notice that it's effective. So those are most of the things that we tend to talk about during follow-up visits. So yeah, I don't have another patient until 10, which is my new patient. Yellow notebook. It's just a spiral notebook that I think I got from CVS or Target. And honestly, I just use it to write my notes as I have the patient sitting in front of me talking to me. I don't like to type and like talk to them and ask them questions because I want to kind of be present and, you know, give them my full attention. So I'll say, you know, I'm going to be taking notes while we're doing the interview. And I'm not writing the whole time. I'm giving eye contact. I'm asking questions. I'm storing some things in my brain, but most of what I'm doing, I'll be writing down, or most of what I'm asking, I'll be writing down. And as I've grown into my flow, in a sense, I don't have to write as much as I used to when I first started. So what I like to do before my new patient visit is we will have the patient submit a new patient form, and basically it kind of asks the questions that I'll ask in the interview. Are you taking any medications for any psychiatric illnesses at the moment? Have you ever been diagnosed with a psychiatric illness? When's the last time you sought care? Do you see a therapist? Do you have any medication allergies? Have you ever been hospitalized? Do you have any medical ailments? Does anyone in your family have any psychiatric illnesses? Do you use any drugs or alcohol? Things like that. So typically, every patient has to fill one out. And honestly, I just like to look at it to kind of just give me a brief idea of what I'm walking into, so then I can kind of prepare myself. Because, you know, if you have a patient that comes in and they are saying that they feel depressed and they're anxious and they've never seen anyone, then I know that I'm going to be making the primary recommendations for medication management and therapy. If I have a patient who has been diagnosed with major depressive disorder and anxiety for 5 or 6 years, they've been on medication, they know what works for them, they've seen a psychiatrist, they just need a new one for whatever reason, then I can kind of, you know, get to the nitty-gritty of asking them their history and then kind of saying, okay, well, you've tried this, do you feel that it was effective? Do you want to continue that regimen? Are you interested in trying something else? Like, I kind of like to give them the autonomy to kind of, you know, maneuver their care with me because they know themselves best. So if they've been taking a medication that they feel has worked for, you know, 5-10 years, and they just need a new prescriber, you know, it's kind of like, okay, we have a game plan, you know what works, and we'll just continue with that, and then we'll do follow-ups. So I'm just gonna look over their information. This patient is a female. She's 43 years old. Let's see. Okay, so it looks like she has a known diagnosis. She is already taking medication for that diagnosis. It's 9:43. Their appointment is slotted for 10 o'clock. We typically request that they are here 10 to 20 minutes early, just to, if they haven't complete their new patient form, sign their medical release form, just in case we need to share their information with other providers, or we want to request information from other providers. We have the medical release form, basically stating that we have their permission to get medical records or exchange medical records, and vice versa. And then with every new patient visit, we do have them do a drug screen. We'll do drug screens for punishment. We just kind of want to have a baseline of, you know, what we're dealing with if patients aren't forthcoming when you ask them about their drug and alcohol use. So that just kind of gives us a good idea of where we're starting. And then typically I have them come in and then we talk. It typically takes me 40 minutes to 1 hour to complete a full psychiatric evaluation. Even if the patient has, you know, already been established on a medication regimen and they know what works for them, just because they're new to me and I kind of have to get their history. And history pretty much entails, you know, why they're here, why they're seeking care, the history of their illness when they were first diagnosed, what medications they've been trialed on, have they been hospitalized, how many times have they been hospitalized, what led to their hospitalizations, what's currently going on at the moment, so the history of their present crisis, past psychiatric history, like I mentioned before, just kind of what's been going on since you were diagnosed, or what was going on before you were diagnosed. When did you first feel that you were depressed, or when did you first start hearing voices, versus when did you first seek care? Because some people deal with depression in childhood, or, you know, may hear voices in childhood and they never, you know, mention it to anyone or seek care until they're teens or adults. So that's important to know, like, when did you first start recognizing the symptoms? And then of course substance use history to include drugs, alcohol, so how they're presently feeling, what's going on with them at the moment, if they're on medication, what symptoms does the medication help with, does the medication not help with the symptoms, what's going on there, family history, does anyone in your family or has anyone in your family ever been diagnosed with any mental health? Most mental health disorders are genetic. So typically if you have a patient coming in undiagnosed and their grandmother or mother has bipolar disorder or schizophrenia, or grandfather, you know, someone in the family lineage has a mental health disorder and they're presenting with the same type of symptoms, you can kind of say, okay, you know, you may have schizophrenia, you may be bipolar, you may have bipolar disorder with psychotic features, you may have a schizoaffective disorder with bipolar-like behaviors. So family history is very important. And then we do social history. Social history is where were you born and raised, who was in the household, or did both parents raise you, how many siblings did you have, how did you do in school, did you attend college, did you graduate high school, did you graduate college, what was your upbringing like, any history of physical abuse, mental abuse, verbal abuse, sexual abuse. All of those things are important, because when you kind of get into what happened in their childhood, some of the things that patients may experiencing may start to make sense. And that can also helps me understand, like, if I want to refer this patient to therapy. If there's a lot of trauma in the childhood and they have PTSD, they're having nightmares, and they kind of haven't dealt with those traumatic events that happened in childhood, then I'm definitely going to refer you to a therapist, despite what your diagnosis is. So yeah, the social history for me is very important piece when thinking about if I want to recommend psychotherapy for my patients. And then your work history. Have you held a job? Have you switched jobs frequently? What are you doing currently? Are you unemployed? Are you on disability? Are you married? Do you have any children? What type of things do you enjoy doing? Do you enjoy doing the things you used to enjoy doing? Those are all questions that are very important. And then of course, medical history. You want to know if you have high blood pressure, diabetes, because unfortunately, some of the medications that we use to treat mental health disorders can predispose you to diabetes, high blood pressure, all of those metabolic disorders that you can have. In addition to, you know, some medications may be contraindicated with your, say you have hypertension and you're on a antihypertensive, and I want to prescribe you NDRI, which is a norepinephrine dopamine reuptake inhibitor, but I don't know that you have high blood pressure. I wouldn't prescribe that to a person with blood pressure issues or hypertension, because norepinephrine is a hormone that causes your blood pressure to be increased. So I would steer away from things of that nature, based on their medical history, if they've ever had surgeries. Of course, allergies are important. And then I would do the mental status exam, which is kind of just me seeing how you're behaving. If your speech is pressured, if your speech is restricted, how do you process your thoughts? Are you blocking thoughts? Are you forgetful? Are you aggressive? Are you laid back? Do you appear anxious? Can you make appropriate eye contact, or are you looking away when we're talking? Things like that. What's your mood? Have you ever had suicidal ideation, which is the thought of wanting to die, or even active suicide ideation, which means wanting to die and having a plan to do it? Have you ever felt homicidal towards other people? Do you hear things? Do you see things that other people don't hear or see? Do you feel things that aren't there when you look? Like, as I'm talking to you, I'm kind of working your diagnosis up in my head. And then when I have and it's not always clear cut, sometimes people can present as depressed when they may have bipolar depression. They just don't realize that the manic state of their bipolar disorder is a disorder in a sense. So they may come to you, and mostly this is how bipolar depression presents. They typically are coming to seek help because they're depressed. When they're in a manic state, they feel great. They don't typically come in and say, hey, I have this energy, I don't need sleep, I'm getting all of these things done, I need help, I don't want to have this energy, I don't want to be task oriented, I don't want to be goal directed, they don't typically come during that phase. So they typically will come in the phase where they're depressed and they're saying, I'm unable to get out of bed, I can't eat, I can't sleep, I don't have any energy, I don't have any motivation, I just want to die, things like that. That's when they come to you. So typically those patients present as depressed. You kind of just have to pay attention and ask the appropriate questions, because you can miss out. But you don't always have a definitive diagnosis on the first, at the first appointment. Sometimes it changes. If I have a inclination that maybe they have bipolar depression, his mom was bipolar or his grandmother was bipolar, but he's saying he's only depressed, maybe I'll just work him up as major depressive disorder versus bipolar depression, and I'll continue to work with him and ask him questions to rule out one or the other. And then from there, once I come up with a diagnosis, I make my treatment recommendations, which always includes just providing supportive advice, providing coping mechanisms, providing medication management options, providing the side effects, or educating them on the side effects, how long the medication typically takes to work, things to look out for, things that are emergent that I should be called for, when to stop taking the medication, when they should feel better. And the tricky part with antidepressants is that you typically don't see a benefit until 4 to 6 weeks. So medication compliance, I stress it, because people want to feel good when they leave, when they first start taking the medication. It's like, when you have a headache and you take a Tylenol, you expect your headache to go away in 30 minutes. So, as a culture, we kind of are immune to immediate gratification. So I stress the importance of compliance with antidepressants, and specifically because they do take 4 to 6 weeks to kind of work and for you to feel better. And like I mentioned earlier, oftentimes I'm definitely gonna recommend psychotherapy, Psychology Today, which is a great resource to find a therapist in your area. Most therapists now are doing virtual therapy just because of the climate of COVID, and I think people have gotten into this state of mind where okay, I can do my job from home. I don't need to go into an office to do what I do. So most of therapy is is offered online, which a lot of people enjoy. And on typically with new patients, starting on new medications, if you've never been on anything, I like to follow up in 3 weeks just to make sure things are going well. And I always tell them, don't hesitate to call me if you have any questions or issues. Don't wait until 3 weeks, because I hate for you to have an issue with the medication, you not take it, then I see you in 3 weeks and we don't have anything to go off of because you stopped taking the medication the second day I prescribed it. So I always give people the option to call me if they have questions, if they're having side effects that they can't tolerate. We typically say wait about a week if they're tolerable and they should subside. If not, give us a call and we'll figure out what we can do instead of waiting until your next appointment. So new patients, I typically like to talk to them again in 3 to 4 weeks just to see how things are going. Existing patients that are on medications and I'm making medication changes, I want to see you in 3 to 4 weeks to make sure the change is effective. Patients that have been stabilized, we haven't made medication changes in a while. They feel good every time I talk to them. Their mood is stabilized. They're sleeping well. They're eating well. They're in therapy. Therapy is going well. Life is going great. Work is going well. Children are good. Then I may say, okay, you're doing well. I'll see you in 2 to 3 months. So typically, yeah, that's about what I'm doing for most of my day. And occasionally I will have an injection, IM injections, antipsychotics that stabilize their mood, which means typically they don't have to take any oral antipsychotics or mood stabilizers for bipolar disorder or any of the schizophrenia diagnoses. They can just come in once a month, get a shot. And I usually recommend this for younger people that maybe don't do well with medication compliance. They're forgetting to take their medications. I'll say, hey, okay, we can do this. Take your mood stabilizer for 2 weeks to make sure that you don't have an allergy, to make sure that your body tolerates it. After the 2 weeks, you come in, we'll give you this injection. You come back once a month, you don't have to take a pill. And most people like that, especially my younger patients. They do like it so they don't have to remember to take a pill every day, are on additional medication as well. But the IM injection does sustain them for 4 to 6 weeks. So those are typically the other patients that I see in person. So it is 9:59 and my new patient should be here already. All right, y'all, I'm back. It's 10:10 and my patient decided that she wanted to reschedule. It's 10:10 and my next patient isn't until 12 o'clock. Y'all, this never happens. And then my next patient is at 12 and then I go to lunch at 1 for an hour. So yeah, I knew that my schedule wasn't as full today. So I did bring a book that I'm reading, more for personal reasons and probably for educational purposes as well. And then I think I will definitely be able to use it in my daily practice as a nurse practitioner. But I have a 3-year-old and this mothering thing can be quite difficult. It's amazing, but so I found this book on Amazon. It's called The Whole Brain Child by Daniel Siegel and Tina Payne Bryson, New York Times bestseller list. And it's about 12 key strategies. And Daniel Siegel is a neuropsychiatrist. So the synopsis says, it's a revolutionary approach to child rearing with 12 key strategies that foster healthy brain development, leading to calmer, happier children. So I got it off Amazon. It says it's $17 on the back of the book, but I think it was like $13 when I purchased it. Came in a day. So I'm working on my trauma-focused cognitive behavioral therapy certification. I'm not working on it. I paid for the course the other day. And it's 11 modules. It's self-paced, so I'll probably do some of that as well. And it's just a certification that certifies me to do cognitive behavioral therapy, if that's something that I would like to offer in the future. It's trauma-focused, so like I mentioned earlier, it focuses on those traumatic events that people experience in childhood, to include abuse, So I'll probably take a look at that. Hopefully. Oh, I'm also working on, I have a patient that has alcohol use disorder. It's pretty chronic. And he also has schizoaffective disorder, bipolar type. So 2 diagnoses, we call it dual diagnoses, which can be difficult, especially with medication management. If you have chronic alcoholism, if you know anyone that suffers with chronic alcoholism, then you know that that is a priority. So, it becomes difficult when we talk about medication management and someone that drinks alcohol pretty much all day. So I am trying to help him and his wife find him a rehab facility that's inpatient, that also does medication management so they can manage his medication, as well as that accepts their insurance, which they've been having a difficult time finding. I started seeing him in November, and I referred them to a few places that they could look into. I reached out to a facility yesterday. I called them just a few minutes ago, gave them his insurance information to see if they accept his insurance, to see if we can get him some inpatient treatment. So I'll be working on that today, as well as working on 2 letters for 2 patients, actually. 2 letters of diagnoses for 2 patients. I'll be back later. I received a call back regarding the rehab for my patient, and he does qualify for it based on his insurance, but the program seems to be a program that's tailored to people that are already detoxed, and they just need therapeutic services, medication management, support and resources to maintain sobriety. So they have programs that he qualifies for, as well as his Medicaid does pay for it, but they are requiring that the patient be medically detoxed. It's dangerous to detox in a place where you're not monitored frequently, in a safe environment where they can't give you medication if you do have seizures, or whatever the case is. So they are requiring, because of his use, that he be medically detoxed at a facility that does medical detox, which isn't them, and then he could be a candidate to go there after he is safely medically detoxed. So I am going to call him or his wife and give her this information and see how it goes. Well, they didn't answer, so I left the voicemail, and I will hope that they will call me back. If they don't call me back before or once I come back from lunch, then I'll try to call them again, because it did go straight to voicemail, so maybe the phone is dead or turned off or whatever. So I'll try again later and then go from there. Alright, so I had an impromptu visit. I had a patient drop in that was supposed to come in yesterday for an injection, and he wasn't able to make it. So he came in today, and the A is missing, but this medication is Abilify Maintainer. It's a 300 milligram pre-filled syringe. Its generic name is aripiprazole. It is FDA approved for both bipolar disorder and schizophrenia. This particular patient receives it for schizophrenia. So it comes with the instructions. It's a pre-filled chamber. It tells you how to, it comes separated. So there's a powder and there's a fluid, and you break the seal to push the fluid and mix it with the powder. You shake it for 20 seconds. And then, of course, you expel the air. It comes with 3 sizes of needles. So based on the patient's body type, will tell you which needle size to use. I went in his left deltoid, and we used a 1-inch needle. So yeah. So typically after a patient receives an injection, I have them sit for a while just to make sure we don't have any issues with side effects, them feeling dizzy, fainting. I did have a patient. She wasn't my patient. I was helping out one of the other providers who came in for her monthly injection, I gave her her injection. I had her sit for maybe like 5 minutes before we got up, and I gave her her paperwork to schedule her next appointment and leave the office. And as she hit the door, she fainted and she hit her head, and we had to call EMS. So that traumatized me. So I kind of have like PTSD, you know, so I'll just have them sit, make sure everything is okay before we let them leave. And then when I have patients come into my office, of course, I like to clean after they leave. So I'm gonna be extra. I'm going to use the Lysol spray and Lysol wipes for no particular purpose. I do that each, and I do that after each visit. So, yeah. Of course, wash my hands. So, of course, after every visit, phone call, in-person visit, I have to write a note. So, yeah, for most of it, I have like a template that I can like fill in most of the information that I need, and then I just tailor it to the patient. So I am doing that now. And I just have it in a Word document. I'll copy and paste it. And if, you know, that doesn't apply, then I'll edit some things and switch it out. But instead of having to type everything out every time I do a note, which is after every patient, I just choose to do it this way, which saves me a lot. Then at the end of my note is where I write my plan, and that's the end of my note. 11:48, and my next patient is a phone call at 12. She didn't answer. Oh, I am on the road today. I don't know what's going on with the universe, but I am appreciative of such a thing. So maybe she'll call back. Typically, they'll people will typically call back within their block of time so that I'm still able to do their appointment. So maybe she just missed the call and she'll call back. So we'll see. My goal is to get out of here to go to lunch early because I forgot my lunch this morning. And even though I get an hour, sometimes commuting to going to pick up the food and coming back takes 20 to 30 minutes in Atlanta traffic. So I'm gonna try to get them out of the way. And we'll see if she answers. Quick call. This patient is being treated for ADHD. She's on a stimulant by the name of Vyvanse. She's been tolerating it well. It's effective for her ADHD symptoms. So I just spaced her next visit out to 2 months instead of doing it next month, since she's stable. And she's not really requiring many changes. But she does, of course, have the option to call in if something changes and she needs different medication. She's having some issues with her mood, but she's only on Vyvanse, and then she takes Xanax as needed. So, all right, so I just finished the follow-up call with the patient who has major depressive disorder, generalized anxiety disorder. I had increased her antidepressant last visit back in December, and she feels her mood is stabilized. She says she doesn't feel depressed, but she's mostly complaining of chronic fatigue, lack of energy. So instead of adding the medication to help with her energy, I am opting to send her to LabCorp to have some lab work drawn to see if, you know, she is fatigued for other reasons. So the labs that I'm sending her for include a complete metabolic panel, a CBC B12 and a vitamin D, just to make sure her vitamin stores are appropriate. Iron level, just to make sure she's not anemic. A TSH level, which is a thyroid stimulating hormone, which oftentimes can be low in patients, causing chronic fatigue. If they have thyroid issues, then they sometimes complain of chronic fatigue, so I'm going to have them check that. And hopefully when we get the lab work back, we will either be able to point at a certain direction and say, you know, you may need to do other supplements, you may need iron, you may need a vitamin, to see if that helps with her fatigue, versus adding another medication just to give her energy. I do have a medication in mind that I typically prescribe for patients that are depressed and complain of lack of energy, motivation, but it can also be an appetite suppressant, which is why I don't want to give it to her, because she's already complaining to have a poor appetite. So I am opting to have her get some lab work done to make sure that there isn't anything else going on. And then once I get the results back from that, I'll go from there and decide what needs to be done after that. So, all right, y'all, it is 3:24, and I just finished up a new patient evaluation, 60-minute visit, but it took us about an hour and 20 minutes. And just listening to this patient's story, we are so strong, we are so powerful. We really have to prioritize ourselves, our mental health, and take care of ourselves. Like, as women, we're natural providers, we're natural caregivers, we want to pour into others, but like, if we aren't doing well, like deep down in our core, then it's inevitable that we're gonna break. And you know, we shouldn't have to go through that. So I just wanted to say that was a good session. And she has a powerful story. Resonates with me a lot. Definitely similar struggles that all Black women go through. And you know, she mentioned that she was proud of me because I was so young and you know, smart, and you know, listening to her and making the recommendations. But like, I'm proud of her for, you know, putting herself first, you know, especially as a parent. You know, she's an older woman. I wouldn't say older, but older than me. And, you know, just giving so much to so many other people and neglecting herself, her child self, you know, those inner traumas, those inner wounds. So I just wanted to come over on here and say that it was a good session. I think we had an amazing breakthrough, and I'm excited to see her progress and how things work for her over the next few months, and you know, helping her kind of navigate finding a therapist and managing her medication. So I'm so excited. I just wanted to say, Black women, our mental health matters. Black men, we need y'all. Y'all mental health matters as well. And I'm just glad that I can be one more Black face that Black women and men trust with their pain and their struggles, and they trust, you know, my expertise, and you know, that they can appreciate that I'm listening and I'm hearing you, and I feel you, and I want you to get better. Because finding providers and therapists that you feel can relate to you, care about you, you know, hear you, are listening, is not an easy task. And I can say that as a human, like finding a therapist and doctor that, unless you know what the hell you're talking about, that you feel like somebody listening to you, is not really, it's not easy. So I'm glad that I can be added to the pool of African American providers to, you know, have my fellow African Americans and people of color that feel comfortable with coming to, opening up to, talking to, exposing their greatest, deepest, darkest secrets and traumas. Trust me with those things, and trusting me with managing, or help them manage what they're experiencing. So just wanted to encourage everyone to put yourself first, because if you don't, you can't truly take care of others. And if you are able to, if you've been doing that your whole life, you're saying to me, Destiny, I've been fine, I haven't seen a therapist, I haven't needed medication. Think about how life has been for you. How have you been struggling? Have you damaged relationships? You know, have you damaged yourself? Are you self-soothing in other unhealthy ways? Just think about that. But yeah, love you guys. So despite me not having a full schedule, today was a busy day. It's like 5:05. And coming to work with me, I really enjoy bringing you guys along. I hope that this video was very informative. As always, like, share, comment, subscribe, and send your friends to my channel. Anyone aspiring to be a nurse, aspiring to be a nurse practitioner, anyone suffering with mental health, anyone need encouragement with seeking out mental health care, send them over to my channel. And thanks for watching. Peace.